I've got a question for you. When was the last time you visited your dentist? Are you avoiding going because you're afraid of what they may find? The fact is, the longer you wait, the more problems can develop. Over 47%, which is about 67 million Americans, suffer from gum disease. That is a staggering number when you think about it because it's such a preventable disease. Now that we're in September, which is National Gum Care Month, I thought for this week's video, I would take you actually into the dental office and discuss how we evaluate the health of your gums, diagnose gum disease, and the different types of cleanings that are involved. As a dental hygienist, one of my roles is determining what kind of cleaning you're going to be, whether you're going to be a prophy or deep cleaning or something in between. Here's what to expect at your dental visits. We check health history and medication, we take blood pressure, and we screen for oral cancer. And now we move on to x-rays. At this point, we are ready to do the periodontal screening to determine the health of your gums. We use a dental instrument called a probe. It looks like a tiny ruler. The measurements are in millimeters. Each tooth is recorded by gently placing the probe in between the tooth and gum line, and we walk it all around every tooth. There are 6 sites of every tooth that are recorded. Based on the pocket depth determines the health of your gums. If you saw my last segment, Why Your Gum Health Matters, I explained one of the symptoms of gum disease is bleeding, swelling of the gum tissue. Plaque forms tartar over time. So the longer the bacteria sits around the root of your teeth, the more damage can occur. Damage to the jawbone often goes unnoticed. You may not have any pain or discomfort other than just bleeding and maybe bad breath. So what measurements determine healthy and not healthy? I'll show you. So a healthy pocket depth is between 1 to 3 millimeters. And if you don't have any tartar buildup, then you could qualify for a regular cleaning. Now, once the probe reaches a 4 millimeter pocket, then that gives us a sign that there may be something going on. We have to obviously evaluate with x-rays to make sure that there's no bone loss involved. Sometimes just a simple cleaning can still be done if it's gingivitis. If we start getting a 5 millimeter pocket or even deeper, then that tells us there could be bone loss. We cannot diagnose periodontitis or gum disease without x-rays. Once we establish that there is bone loss and active gum disease, then yes, this would be an indication to do what we call scaling and root planing or SRP or deep cleaning. Now there is a difference. You can have just a few areas of 5 millimeter pockets. That's when we would do what we call a localized or spot scaling treatment. Now for the rest of the mouth, we could probably just do a regular cleaning. But for patients that come in and have multiple areas of 5 millimeters, maybe more than half the mouth having 4, 5, 6, or even deeper, and generalized bleeding, then that's when we would do the entire scaling and root planing. Now, because this cleaning requires us to go deeper below the gum line to remove the heavy tartar buildup, we can use a topical gel that we can place under the gum line, or we can also just do a localized injection, basically a shot, to make sure you're numb. So of course, we always discuss the options with you, and based on each individual, it will determine what's best for you. We want to make sure you're very comfortable during the procedure. We do the scaling root planing treatment in 2 visits. We usually do one side of the mouth and then the other. We use a Cavitron or a piezo, and this is like a water, kind of like a high-powered water pick. It has a vibration and water to help break up the tartar buildup. And of course, we always use a suction to make sure that you don't swallow any of the debris. And then once we do that, once we get most of it off, then we go back with our hand scalers and just slowly and just meticulously feel around the gum line and around the root of the teeth just to make sure that we don't leave anything behind. And a very common question that I get asked often during the procedure or before the appointment is, will there be bleeding? And the answer is yes. Expect bleeding, but it's not the bleeding that will continue after you leave the appointment. This procedure is not a surgery. It's not like a tooth extraction that you have to leave gauze in your mouth for hours. We usually recommend avoid eating anything that requires much chewing. Just be aware that you are gonna be numb for a few hours. So you can definitely drink smoothies, protein shakes, soup, something that's pretty simple. Just avoid you biting your tongue or your cheek or lip. And talking may be a little difficult, so I don't recommend you going and doing a presentation after you have your cleaning. And do anticipate maybe a little tenderness or soreness. Simple over-the-counter pain medications work really well. Ibuprofen is probably one of my favorites, but if you can take Motrin, Tylenol works really well too. Just be aware you're gonna have some soreness, again, maybe a few hours, but usually by dinner time you should be fine. Special antibiotics can also be used in combination of SRPs in certain cases. They work after being inserted and left to dissolve in the pocket. And it's common, of course, for us to give our patients a prescription mouth rinse to be used at home to enhance their home care and improve their gum health. It is common to have hot and cold temperature sensitivity after the scaling and replaning treatment, especially the first few weeks. Sometimes we'll do fluoride treatment like a fluoride varnish afterwards, or even just having our patients use sensitivity toothpaste. Now, there are certain situations that patients come in and they have an excess amount of tartar buildup, so much that we can't measure or even access the pockets. That requires us to do what we call a gross debridement or full mouth debridement. So once we do that, it's basically removing the heavy tartar buildup above the gum line with the Cavitron to access the pocket depths. So this is a patient that came in very motivated to improve his oral hygiene. He had bleeding gums, complained of bad breath. So once we evaluated his x-rays, obviously we noticed the bone loss and also noticed the heavy tartar buildup around his teeth. So after further evaluating his periodontal health, clearly he had 5 to 6 millimeter pockets. So of course we decided on the scaling and replaning treatment. This is what it looked like after we did our first treatment. And he eventually came back to finish the second treatment. And we took this x-ray once we completed the scaling and replaning, and of course it was a successful treatment. You could see no buildup on the roots of the teeth. It is a clean root surface, and this patient continued to maintain proper oral hygiene every day consistently. And he also maintained his regular visits, which we recommended every 3 to 4 months. So we followed up twice over the last 2 years, and look at all those numbers that are improved. All of the green numbers indicate a reduction in pocket depths, and if you look closely, most of the numbers are back to normal, between 2 and 3 millimeters. This is a perfect example of somebody that came into our office and was motivated to improve their oral hygiene. He will be at risk for future gum disease, but he is consistent with his home care, and this is a perfect example of what you want to do after you have your scaling and replaning. Remember, you and your hygienist are a team. Once you complete the SRP, it's up to you at home to really take their advice. They're going to show you proper oral hygiene instructions. They're going to show you how to successfully remove plaque every day by flossing, brushing. They're going to recommend certain tools that may help, like water flossers. They're wanting you to have a successful outcome. We want to ultimately improve the health of your gums. And hey, these help too. Now, usually we'll recommend follow-up visits after 4 to 6 weeks to evaluate the pockets and of course remove any surface stains and make sure there's no residual calculus. During this appointment, you shouldn't need any anesthetic, but if there's certain cases where the pocket's still deep and bleeding and there's some residual calculus, then of course we will make sure we do some kind of anesthetic or numbing gel just to make sure you're comfortable. Your dental hygienist will then schedule your follow-up visits called peri-maintenances every 3 to 4 months. This will allow us to look closely and monitor the health of your gum. Every year, a new periodontal chart should be done. This will help determine how often we will need to see you. Our goal is to get you back on a regular visit, which is every 6 months, but everyone does not fit that category. If you happen to have severe gum disease, then of course we would recommend still seeing you every 3 to 4 months. Certain situations, if the pocket is a 6, 7 millimeter pocket, still bleeding, then it's often we refer you to a gum specialist called a periodontist. I know I've said this multiple times and I'll say it again, how important it is to maintain meticulous oral hygiene at home. Keep the flossers in your car, just brush, floss every day. It's not just the health of your mouth, it's your overall health. Well, I hope you found my video helpful and informative. And if you've been putting off going to the dentist and after watching my video, I hope this pushes you towards the right direction. And if you've experienced a deep cleaning before and you feel open enough to share it in the comments, please do. Any questions or concerns, drop it in the comments below as well. Please give me a thumbs up, and if you haven't subscribed to Burst TV, definitely do. As always, stay tuned every Thursday where Burst TV drops a new video. Take care and be safe.